Okay.
Good
I'm
morning.
here.
Good morning, Dr. T. Good morning, good morning, good morning. It's a good day. I'm excited to be seeing your beautiful face. Oh, my.
Thank you.
Yeah. So, how is Canterbury? Because I see you're wearing a Canterbury shirt. How is
Yeah. Yes. The city of Canterbury.
so?
Yes.
How
Archbishop
are
of
you?
Canterbury lives here.
Yes. How are you? How was
I'm
your week?
good.
How was your week?
Excellent. I'm loving life. It's warm. It's
I
good.
know, right? Summer is here. Yes.
Yes.
So let's just give our viewers 1 more minute. Chi, I'm sorry, but I can. Chris, Chris offer joined. Okay, Chris offer. Okay, I'm sorry. I hope I didn't stab your name. Welcome to joining Moments with Toying this beautiful Saturday morning, the 26th of June, 2021. Today we would be discussing the issue of visual impairment. Vision, and Dr. Chi Vision, like she's known for, will be doing justice to that topic. And it's 8, yes, so we're good to go, Dr. Chi.
Good
Um,
stuff.
yes. Okay, so let me do a formal introduction of my guest, and then we can take it up from there. Dr. Chibuzo Uwadi is a UK registered optometrist. She obtained her doctorate of optometrist in Nigeria, her doctor of optometrist, sorry, in Nigeria. She also obtained her postgraduate diploma in community eye health, UCL London, and a postgraduate certified in global health from Harvard, USA. Yeah, even though she's not in the United States, she's still related to me. Since then, she has become a fellow of the American Academy of Optometrists. Amidst all her achievements, she continues to hold the membership in the College of Optometrists, MC Optom, and the Association of Optometrists. Dr. Wadi is the director of Vision Care Logistics Group Limited, an optometry domiciliary service, delivering service um, to housebound patients. Her wealth of experience as an optometrist covers a range of sectors within private organization, National Health Service, NHS, eye examination and domiciliary eye care. She spends time providing education to individuals and organizations on preventive measures with regards to visual disorders. She is an advocate for prevention of blindness, particularly around to optical ailments which causes blindness, such as diabetic retinopathy. That's okay. Cataracts, glaucoma, uncorrected refractive errors, and age-related macular degeneration, to name a few. Since being qualified, she has worked at many practices all over the United Kingdom, including London, Swindon, Devon, Norwich, Cambridge, Kent, just to name a few. Wow, wow, what an awesome bio. Okay, so we don't go to there's so much about her, but I would really like for her to take the floor and formally introduce herself to our viewers. So please, Dr. Chi, the floor is yours. Who is Dr. Chi?
Wow. This is exciting. Thank you, Toyin, for this moment with you. It's exciting times. Yes, Dr. Chi. I'm known as Dr. Chi Energy the Illuminator. And professionally, I'm an optometrist. I look at eyes, I look after eyes, and I correct eyes, and I help people see better. And also manage expectations, because when you're looking into people's eyes, there are different levels of expectations that people have. And that's why I'm there. But when I'm not testing eyes, I'm a vision care specialist. And what that really means is I illuminate mindsets, I illuminate people, I help them believe in themselves, I help them lead authentically, and also, you know, discover and manage their purposes. So I'm not just an eye doctor, I'm also a vision doctor. So I love people, I love eyes, I love vision, and I love to re engineer mindset, because when your mindset sees well, then your body will be full of light. That's Dr.
Wow.
J.
Wow. Wow. Thank you so much for that, Dr. G. It shows that it's not just about the profession, it's about, there's much more. Impact
Yes.
is what I hear, and that's amazing. That's amazing. Thank you for that introduction.
You're welcome. Thank you.
So let's now dive in straight into why we're here. Visual impairments. What is visual impairment?
Visual impairment is a big word, but the even though it's a big word, World Health Organization is quite interested in it, because about 2.2 million people are
Wow.
visually impaired globally.
Mm.
And what does that mean? It just means that there are different levels of expectations that we want you to see
Hi.
things, be able to drive, or things that you're able to coordinate and live a normal lifestyle. And
Mm.
people are not having, these 2.2 million people can't have it. So it could be a child, it could be an adult,
Okay.
and it could be an aged person. So visual impairment is a question of, can you see clearly within the expected vision? So in terms of numbers, the numbers we use are things like 6, 20, 6, 30, or in the American setting, 20, 40, 20, 60. Those areas are the limits where you look and say, this is a visual impaired person. And
Oh.
obviously, there are things that can trigger visual impairment. And the most common cause is refractive errors. We'll get to that.
So for a layman like me, refractive errors. You see, I struggled a bit. Like, when I saw certain terms, I'm like, okay, what what is refractive errors? What's that? What does that mean?
Refractive error is the inability to see clearly. Maybe
Okay.
you need glasses or need
Mhm.
contact lenses
Okay.
or any other form that can enable you to
Hi.
see. So when there's an error in the way you see, and that it can be corrected or
Oh,
not corrected. But that's what refractive error is.
okay. Okay. So, having said that, would it be fair or right to say that when there's a form of or any form of visual impairment, that could be a form of disability?
You can't say that. You can't say that because visual impairment is a group word for
Hi,
inability to
Vicky.
see clearly. It's a group word for inability to see clearly. But remember, it's a global problem, which
Okay.
means for every household, the 7 billion people on earth,
Wow.
2.2, when you work it out, the percentage is humongous.
Yeah.
So it's a problem globally. But when you say visual impairment, it's about not seeing properly or even going blind. So
Mm.
it's almost a range of levels that we
Spectrum.
need to break down. So if I start from when a child is born, for instance, a child is born, the expectation is that you can see. Okay, we have certain ratings of when this child is born, you can see lines. Then when you can see lines, then as you get older, you can see bigger lines, and then
Mm.
you see smaller lines. Then you can,
Wow.
when your mom is breastfeeding you, you are
Mhm.
expecting the child to be able to notice the mom's nose and recognize faces. But even from that level where mom is breastfeeding a suckling baby, you can notice changes in the eye. One, you can notice things like cataracts
Okay.
in the newborn. But cataract of the newborn is very dangerous because not every white pupil is cataract. It could be cancer of the eye.
Wow.
Okay? You can have immaturity of the retina, which is also in newborns.
Purple
Okay?
by
Which causes retinal
Jennifer.
detachment
Hi.
in newborns.
Mm-hmm.
Okay? Then
Yeah.
you can have things like glaucoma in newborns.
Wow.
Then you can have infections like gonorrhea, syphilis in newborns. I'm emphasizing in newborns, and you can have things like if impact of measles, rubella. These are diseases of newborns that can easily impact, on babies. So when a child is born, if some of these things happen, they impair vision. Remember, it's visual impairment. So any of these things can impair the vision, compromise the ability of a child, a
Hmm.
baby, a teenager to see clearly. So this is where either the pediatric optometrist or the health visitor need to be sensitive during their assessment. I recently had a newborn baby. They called me and said, for 9 months,
Hello.
this child is 9 months, but however, they noticed this child can't see clearly. So there was cataract, and they've done the cataract as we speak, so the child can see again.
Oh,
So mothers, parents, it's not enough to say, wow, I've had a child. Is your child seeing clearly? And if that child's vision is not clear, then it is impaired. And those are the things we need to look out for. And that is those who need glasses. But you see, when you have a child, if a child is also born prematurely, you can, or by forceps delivery, for instance, you can trap the nerves. And when you trap the nerves, you have squints because you're trapping the long nerves involving in seeing clearly. There are several cranial nerves. These are nerves that control looking up, looking down, looking to the left,
okay.
looking to the right.
Okay.
If those one of those muscles are trapped, it will affect how you see. So you might see in Africa what they call 4 o'clock eyes. Those are trapped nerves. And then it could just be that the child has cerebral palsy, for instance. So these are things that could be congenital, or it could be things that has been developed as you go, or even a child could bang their head and fall and break something, and then they trap the nerve and they start noticing that the child's eye is going east or west or cross eye like that. You know what I'm saying? So it's about,
Somebody says half past eyes. Yes. Yeah.
yes, have fast eyes.
Yeah.
Yes.
Yeah. Welcome,
Yes.
Purple Jennifer. Welcome, Noble IJ. Thank you guys for joining. Today's topic. I'm sorry, Dr. Chi, I interrupted you there. We're talking
Thank
about
you.
visual impairments in children, and so thank you for joining. Please feel free to ask any question or any concern. You have any concern? Please feel free to put your question, and our beautiful guests would answer your questions. So that's packed, Dr. Chi. That is packed. Packed information that one has to sit back and then listen and then take that in. Yeah.
Yes.
So because we're talking about children, visual impairments with or in children, um, what would we consider as severe? Because as a
Severe.
special education teacher, it means, for me, it means simple specialized instruction for a child who has visual impairments. Sitting
Yes.
positions, how I teach, how what are the accommodations I will offer the child based on the child's vision and all of that. So
Mm.
what would be considered as as severe in a severe case? You might be wearing glasses
Okay.
and it's not so bad. So what would you consider severe in
Okay.
a child? Yeah.
Severity for me is dependent on, first of all, the diagnosis, the detection. Okay.
Yeah.
Detection, when you detect something, you diagnose it, then you start knowing how to manage.
Mm.
So if a patient comes, or sometimes in some cases the patient doesn't come, maybe a health visitor visited a home and noticed, for instance, that this little baby or this little child, you have a target. I'll use this as a target. For instance, this is
Okay.
a target, and you're trying to get this child to focus on this point, because those are probably one of the tests we might have to run.
Okay.
Okay. And
Mm-hmm.
I'll tell the person to look at the tip of the pen and to follow. It's called a motility test. And you're doing a
Yeah.
motility test and telling a child to follow that movement. That test, as simple as it may be, will help us pick up some sort of saccadic, they call it, quick movement of the eyes.
Okay.
Okay. And if you move that child and he's not following, it's more like being distracted, then you know that something is wrong. Because you need to have a child who can, in some level, follow what you're doing. Now, if they're not following, and or as they follow, you notice that one eye is looking and
Mm-hmm.
one eye is gone out. You know, there's a problem. And you're doing the test. You notice they have what they call nystagmus. You
Mm.
know, you see children like that, their eyes are going.
Okay.
So you have nystagmic movement. You do have them in some albinos.
Okay.
Okay. So those are basic things. And we can do cover tests. A cover test is where I cover one eye and I observe the other eye. Again, I can pick up whether the person has squint or not.
Okay.
Okay. Then I can do things like a reading test or a color vision test. Because believe it or not, there are people who can't tell colors. Okay. And
Yeah.
if you can't tell colors, it
Good
means your
morning.
child, for instance, may not be able to read some
Mm-hmm.
things.
Yeah.
So the person might be colorblind or have some form of color defection. Okay.
Yeah.
Then you have kids or babies who, for instance, yeah, their parents have squint. If your mom or dad has squint, you stand a higher risk of having squint yourself. If your mom or dad wears glasses, you stand a higher risk of wearing glasses as well, especially if you're short sighted. But the commonest for kids, for babies, for visual impairment is long sightedness. And long sightedness is where you see some kids, they are like magnifiers. The glasses are so thick.
Yes. Okay.
And those ones, it takes time, because number one, they can't see afar, they can't see near, and they are probably less than 10 years old.
Hmm.
Then that's where severe visual impairment really kicks in terms of glasses as well. And of course, if you have people with cerebral palsy, again, you have problems because you have coordination issues, you have perception issues, they can't perceive, they don't even understand because of learning difficulty. So for kids with learning visual impairment in combination with learning difficulty, it is a lot. There's a lot to that go into play. So it's about defining what aspect of visual impairment is. But in terms of glasses, there are some levels we can correct with glasses, and there's some we cannot correct with glasses. But it's about detecting it, diagnosing it, and then we start looking at management.
Okay. So in other words, I can say it's a spectrum.
Yes.
Awesome. 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 Um, for parents, what are the early signs to be looking out for? Because
Okay.
because it's a spectrum, you can't say, okay, this is there are different levels, basically. That's what the
Mm.
spectrum, there are different categories of what visual impairment is. But what are just basic, signs or symptoms to look out for when I know you partially touched on, but specifically, what are basic signs to look out for when to be able to say, okay, I need to help my child before it gets so severe.
Okay, I'm going to bang it straight on people of color, people of African origin and
Okay.
descent, for instance. The commonest problems we have is that I don't want my child's eye to spoil because I don't want my child to wear glasses. So you allow the child to just stay.
Yeah.
Now, rule number one, if your child is below the age of 8, okay, and is struggling to see the blackboard or whiteboard as the case may be, or you notice that the eye, when they are tired, drifts away or in or out, you need to be seeing an optometrist. Rule number one, anybody below the age of 8, specifically if it's after the age of 8, you may not have the chance of it being corrected. Glasses is not a fashion statement,
That's a good one.
especially for children. I know some kids may tell my mom, I can't see, I have a headache. Rule number one is not a fashion statement. Your child's inability to see clearly due to vision impairment, like I said, it's one of the top priorities of World Health Organization. 2.2 million. And we're not even talking about kids. We're trying to see how we can resolve it. If you don't help your child see properly because they've complained they can't see in class, and we need to run certain tests to enable them to see properly, number one, you mess up their career, their
Hmm.
ability to understand, their ability to be educated, their ability to see, and their ability to become something in life.
Hmm.
That's how important the child eye is. So each time you're saying, no, 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 you're just joking, get it checked out first. That's one. Two, if you notice you have a newborn and there's a white reflection in the eye, don't take it to quacks. See a specialist. It
Hmm.
could be an eye cancer, it could be a tumor, it could be cataract, but we don't know. So that is cataract in babies, or cat's eye, or white reflection in eyes. It could be, you know, opacity in children. Three, there is premature retina, which I'm just keeping it simple, where people, babies cannot see properly, they can't see colors and they can't see things. We need to speak to a specialist.
Yeah.
And then in terms of, you notice your child is reading something, even when they're little kids these days, they hold things that close.
So
At the
close.
age of 3, 4, 5, that's alarm bells, girl. You need to get it checked out. And if you notice discharge, gonorrhea, infections in the eye or in birth, it could cause blindness. So these are just, and then we have glaucoma, where baby's eyes are looking bigger than normal. You will know when your baby, because you know your baby, the eyeballs are looking bigger than normal.
Bulging out.
There's a swelling, bulging is another thing. Refer it, because it could be glaucoma of the young, of the premature. Then, of course, in terms of glasses, if you don't correct certain glasses, because we need to do some tests, we need to put eye drops, this child will struggle and this child won't see. So basically, it's about mothers, not just mothers, fathers. Look out for your kids, observe them, see how they are reading, see how they are talking, because they could be blind and deaf at the same time.
Hmm.
So if there's major problems like tumors, for instance, in the UK, we had a landmark case where one of my colleagues missed something and he ended up in a case and a suspended sentence. Why? She's an excellent practitioner, but we didn't listen. So headaches. A child is saying, "Mommy, my head aches," and the child is vomiting. It's not a good sign.
Hmm.
So watch what your children are saying to you, listen to them. And if we need to see an optometrist, which is very important, we need to look at the back of their eyes and make sure their optic nerve, which is the nerve center of the eye, we want to make sure is healthy. But if you don't listen to them, they don't come to us. And it could be life threatening. Vision impairment is not just an impairment of your vision as a child. You could have things that are life threatening. In case you don't understand what life threatening means, it can kill your child.
That's straight up.
Life threatening means your child can die. So when I say vision impairment, you think I'm just stopping. Okay, eyes, your eyes can't see well. But what about not just blindness, but death? We don't want that. So please, mamas, please, papas, when you notice unusual activity of your child's eye, of your child's health, you see, my framework is about the scriptures. And the scripture says, if your eyes be healthy, your body is full of light. So when I look into your eyes, I'm not just seeing in your eyes, I'm looking at your body. So when I'm examining a child, I'm looking, is the heart healthy? Is the brain healthy? Because if your heart is not healthy, I can see it in your eyes. If
Hmm.
you have intracranial hypertension, I can see it in your eyes. If you have what we call papilledema or any of the optic nerve swelling, I can see it in your eyes. But if you don't bring them to me because there are certain um, symptoms that they exhibit, I don't know. And I don't want us to lose our children because of negligence or carelessness. So
Wow.
it is a lot. There's a lot. There's a
Yeah,
lot.
I
But we can
hear that.
work together to make this work.
I hear that. Awesome, awesome. Wow. In just that question alone, I hear assessments. As a special education teacher, usually when we do assessments, we carry parents along. No assessment is done without the parents. And what I also hear you say is the need for parents to be able to assess and observe their children.
Correct.
Your ability to be able to assess and observe your children would save their lives. And it's so
Mm,
important and critical that as parents, we know our children best. And
mm,
because we're in the best position to be able to help our children, it's important that we take notes and we listen to them when there's any little or big complaint. We don't have to wait for the big complaints before we start to
yes.
rush for emergency. So wow, that's in depth. That's in depth. Thank you so much, Dr. Chi, for that.
You're
So
welcome.
having said that, I for one, when you say the word legally blind, how what does that mean? What does that mean? Legally blind.
Sorry. Legally blind.
Mm-hmm.
Now, legally blind is when you, for instance, you're expecting, I think in the beginning I said it,
Yeah.
you're expecting
Welcome, welcome.
20/20 vision, for instance, and
Yeah.
the person is seeing 20/40.
Okay.
Okay. And there are standards. And I think it's pretty much the same, probably in the US and many other countries. So there are numbers, they are a game of numbers. So when
Okay.
somebody sees
Welcome,
twenty
welcome, welcome.
forty,
Mhm.
20/60 vision, which
Yeah.
means the word legal means you can't see enough to drive, expected standard for driving, expected standard for doing basic things that you need to be doing. So, if for instance I have a 2040 vision or 20/60 vision, guess what? I'll lose my license. I need to be at least 610, 675, for instance, or 2015 or something as the case may be. Then I can drive. So it's important that you look at pilots, they have their expected standards of driving, cars, they have expected, but all of them, if you're legally blind, which means you're well below the expected standard, you can't touch a car. So
Wow.
2040, 2060, legally blind.
24 to
And
26.
it's not a movie. I know that's Legally Blonde.
Yeah, that's true. That's true. Wow. 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 That's amazing. For our live guest here, that's viewer, please feel free to ask any question that you have, and Dr. Chi in the house will be able to answer your question. Um, that's a lot of information to take in. For parents, because I'm a fan of parents because of what I do. I'm a fan of children. I live, sleep, breathe. That's all I want to do. And any
Yes.
way I can support our parents, I think that's what I'm called to do. And I gladly and freely would do that.
Yes.
What should, no, let me say what should. How can what a mother eats affect a child? Because whatever you take in reflects on the outside. That's what you will produce.
Yes.
How
Correct.
does that affect the vision of the child?
Okay. Now, mothers are incubators.
Well, yeah.
And because we are incubators, if you incubate rubbish, you bring out rubbish. If you incubate love, you bring out love. So, the question I always ask is, what are you eating when you're
Mm,
pregnant? So, I'm going to start from the pregnancy point. There's a reason why they say to mothers, when you're pregnant, don't take certain tablets. Because those tablets can either help your child get better or make your child worse.
mm,
Those tablets can either evacuate the baby too early or sustain the pregnancy. So, yes, what a mother eats is important to the child. And most importantly, the question I always ask, from vitamin A to Z, which of them help your child? So, vitamin A, things like your green leafy vegetables, is good for your child because that's good for your eyes.
mhm.
Things like papaya, mangoes, red peppers, good for your eyes, good for your macula. Things like eggs, even though sometimes they caution eggs because of salmonella poisoning. So, what you're eating as a mother is good. Again, go on Google, Google for life. But importantly, you're pregnant and you're taking something like thalidomide, which is one of the banned tablets. You will end up with a child without limbs, without hands, and without sockets.
Wow.
Okay? You took a tablet like that. You take a tablet like penicillin. Don't laugh because I'll catch you. You're going to have a baby with brown teeth
What?
because of what you took.
Are you kidding?
And it will affect your conjunctiva. The conjunctiva is the white part of your eye, it goes pigmented.
Wow.
You take certain tablets, which are eye drop for glaucoma drops, and you end up evacuating your baby too early. So it's important that what you take, whether as a tablet or food, you might tell me, yes, that this thing I'm eating is natural herb, is herb from my village. And my mama said, your mama does not know the scientific content of that herb.
Mm.
So these days we need to research, how does that help me? How does that improve me and my baby? Because you don't want to take foods that will create increased blood pressure and you start having preeclampsia.
Mm.
You don't want to take things that you will swallow and your vision, the pressure of your baby unborn
Welcome,
would,
Idausa.
would
Welcome.
increase.
Thank you for
You
joining.
don't want to have things that you will eat and your child will have cerebral palsies or mental problems.
Mm.
So it's important that you don't eat,
Hi, Olinda.
you don't put what is, when you're eating as a mother, don't think of yourself, think of your baby. Because several people have eaten stuff that ended up not just impairing the vision of their unborn child,
Mm-hmm.
but also creating blindness. You've seen people who are born and they have things like retinal detachments, cataract. You're taking, for instance, steroids. Steroid It's an anti-inflammatory. It's a, it reduces inflammation as same as treating all sorts of things. And they mix it in some small quantities in creams and soaps. Teas in creams and soaps. Who want to be fair? But
Oh,
you're taking steroid in one form or the other, and some of these vegetables contain steroids and all sorts, and they're not good for your baby. So before you put in your mouth, think of your baby. And before you eat it or before you drink it, because there are some things you drink: alcohol, cigarette, weed,
Dr. Chi?
you know. Oh yeah, some people do it to shine their eyes more. So be careful what you're putting in your mouth. Don't think
Yeah.
only of yourself, think of your babies, because these
Wow.
things do affect the unborn child. It
Wow.
does affect. And don't forget, I said to you, if you have a squint as a father or a mother, there's a higher chance that your baby unborn will have that as well. And
Wow.
if you're short-sighted, there are higher chances that they will have. So generally, what you eat does affect your baby.
Wow. So
Yes.
that almost goes into my next question that has to do with the quality of life we have impact our children. The
Yes.
quality of life a parent has would impact the child. Your
Definitely, yes.
Yes,
Yes.
our choices as parents would impact our children. So regardless of
Correct.
that, because we're talking about vision, that would also impact your child's vision. Whatever decisions you make, whatever kind of food you eat, all of that impacts the health of your child and you as a parent. Wow,
That's correct.
that's amazing. What you didn't tell us what food we should eat. I know you're not a dietitian, but if we were to I know you're not a dietitian, but if we're to take medications, what kind of medications would it be for a parent who should I be asking you that?
I'm not going to dabble into medication. I'm not a pharmacist. I'm not a
Mm-hmm.
GP. But in terms of food, this is what I relate, which is why I mentioned a few.
Mm-hmm.
Green leafy vegetables are excellent for eyes.
Okay.
I'm very passionate about kale,
Okay.
green kale. The green kale, I juice it. And when you juice it, it's not just good for your eyes, it's good for lowering cholesterol, it's good for lowering blood pressure. And if you can keep your cholesterol level low and your blood pressure low, you can keep your eyes healthy as well. Because if you have hypercholesterolemia and you have clots in your eyes, for instance, or you have high blood pressure and you can have thinning of the vessels in the back of your eyes. So the healthier things you eat, the better. Things like spinach leaves are good for your macula. Things like mangoes and papaya and blueberries,
Oh,
fruits,
okay.
are very good for you. And if you're living in Nigeria, ugu vegetable is rich in vitamin B. Ugu, bitter leaf, ewedu. Don't joke with African food, though.
Mm.
Not pounded yam. That one is not good for you. So something like that is use use what you have.
Mm.
I don't take sugar, for instance. So sugar isn't good for any human being. It's not even good for your enemy self. So eliminate that from. And fruits, some fruits like your grapes have natural fruit, so you can reduce the content of that as well. But increase your seaweed consumption, green leafy vegetables, red peppers, tomato, because they contain lycopenes, which are good for you. I keep going back to papaya and coconut oils, olive oils, and some of these things are good because you still need your fish pepper soup, catfish, salmon. They are good.
Mm. Mm-hmm.
So you have your starseed oil, your sunflower oils. These are good for your eyes and good for your health. So just Just get those plants in there. There's got vegetables in there. But I'm not saying you should be a vegetarian. But if you can, cut down on your beef. Beef is rich in vitamin B, but there are other sources of vitamin B. So you have your cauliflowers, your cabbages, and all those sort of things. Pepper, chili pepper is nice for your eyes, but don't rub it in your eyes. Put it in the food. So
Oh
you
my.
just eat, you just eat just normal things. Sweet potatoes are very good for you and for your eyes as well. But above all, you're looking for things that can reduce impairment. Anything you eat that can help you reduce your risk of cataract, reduce your risk of glaucoma, reduce your risk of macular disease, reduce your risk of retinal detachment, your game. Important as well. Some people sit under the sunlight. It's beautiful out there. UV rays are bad for you. They are bad for you.
Summer is here. Go get them.
Yes, but then they're not good for your eyes because they can cause cataracts and all that. So
Wow.
it's important that you do everything in moderation. Even vitamin A or vitamin D, they can be
Mhm.
poisonous to the system. That's why I prefer natural sources. Plant your and grow your own foods and then get them in there. But above all, it's good to take supplements, but it's good to take natural sources.
Well,
Yeah.
because yeah, thank God you said that because for those of us here, we're in an environment that is exposed to preservatives. Everything in a bit to preserve them. There's so much going on in the food, even in
Mm,
so-called plants. There's so much going on, and so I totally agree with you when you talked about going natural. That's where you have the organic foods. It might be a bit expensive, but in the long run, it's not just about you, but your child. And
yes.
what would
Yes. Even things
subsequently?
like banana and plantain, oh, it contains silica.
Hmm.
Silica is good on your skin. And check my skin out now. I eat banana every hour. You know,
That's
they are good for your skin, good for your
Mhm.
eyes.
Yeah.
Okay. So don't
Hmm.
look at that ripe banana and say the skin. The way it's ripe, like that's how the silica is, and it's good for you. I know
Wow.
I may be saying it in a softer and whatever tone, but it's healthy to eat the right things, eat the right fruits, eat the right vegetables. Everything is done in moderation. You'll be fine.
Wow. 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 Thank you so much, Dr. Chi.
You're
This is
welcome.
packed. Now, yeah, it's really packed. You are the professional here, right? For
You're welcome.
on a final note, because you've taken everything and you've put it in a box for us. And for our viewers, for those of us who would get to see this later on, please take our time to see the end of this video. You would not regret it. So, in summation, in summary, what are your own recommendations for parents who already have kids with visual impairment, or who are already using glasses? And of course, I know that for me it's making sure that there's an accommodation for the child. But from the perspective of an optometrist, what would be your recommendations for a parent who already has a child who has visual impairment? Because apparently, it's a disability. What can I
Yes.
do as a parent to make sure that my child is successful, health wise, but particularly vision wise?
The most important thing I probably would leave on the table for families, for parents, is that be sensitive to your child. That's one. And as much as glasses is part of visual impairment, things like dyslexia, things like Erling syndrome, they are as equally bad. So you need to be able to know when your child is saying, I'm noticing letters are jumping and they
Okay.
can't see clearly. Take
Okay.
them to specialists. If you don't have any, take them to an optometrist near you and will be able to diagnose. And if they need colored overlays, for instance, or colored pencils or we need people like Tonya who is a specialist in that area, we'll refer you to them. And don't joke with headaches and vomiting. I can't say that enough. Everything isn't about glasses.
Okay.
Some of the problems kids have could be not just sight threatening, they could be life threatening. And it's not a fashion statement. I've gone back there. It's not a fashion statement. Children are a blessing, and children are the future of our generation. So when you look after them and look after their eyes, then you can see. Remember, I'm into vision. That's what I'm passionate about. So if a child cannot see, they cannot become the great person
Mm.
they need to become. So it's up to us as parents to look out for them, look after them, protect them, bring them to us to detect, diagnose, and manage them properly, and also save their life. And sometimes we may have to perform surgeries. I don't personally do. We may have to refer them for surgery to be performed in case of cataract, retinal detachment, or we might have to refer them to have other forms of treatment or management, or even contact lenses, or squint corrections, or visual trainings, or all sorts of things. But let's not give up on our children, and let's not ignore them, because they are our future,
Yeah.
and we can make them see better.
Wow. Now, because you mentioned contact lenses, can children have contact lenses, and what's the advantage of having a contact lens as opposed having a pair of glasses? What?
Yes, children can have contact lenses, but I wouldn't say opposed to. Now, there are different types or reasons why kids can have contact lenses, or why people have contact lenses. One, cosmetic reason is one. But
Okay.
secondly, if I had a patient who was minus 12 or minus 13, the child would not feel comfortable cosmetically wearing a very thick pair of glasses. So contact lens is very tiny,
Okay.
flat, stays on the cornea, and nobody knows she's wearing a very thick pair of glasses. So if a little child is wearing minus 12, minus 15 glasses with a minus 4 cylinder and has rugby shaped eyeball, guess what? It's going to be bullied at school.
Mm.
So contact lens
Hi
will be
for
a
me.
solution. So contact lenses will be a solution to such child. And then
Mm.
we have kids who have convergence problem. Convergence means they cannot converge. Convergence means seeing things at that distance and they can't see afar. So we might have to give them multifocal lenses, which means they need to see far, middle, and read. And these days we've got corrections. And then we have what they call myopic controls. And we're trying to control short-sightedness because it is becoming a bigger problem. And contact lenses are used for that for now. So I'm not going to say you can wear glasses instead, or contacts instead of glasses.
Okay.
Depends on what we're managing. And we
Okay.
can give either way.
Okay.
Yes.
Wow. Wow, that's amazing. That's amazing. Because for people like me, I have this idea that contact lens, would it be comfortable? Wouldn't I feel irritated? And would it also be fair for me to say that can people react to wearing contact lenses? Is it possible you react to?
Of course, because it's
Okay.
staying on your cornea, for instance. The cornea is the glassy part of your eye.
Okay.
Because it's resting on your cornea, you might not be it might not be conducive for you. You might have dry eye, you might have irritable eye of some sort. So contact lens is not for everyone,
Okay. Okay.
but it could be for people with all sorts of eye problems. So
Okay.
yes, people can react to it. I wear contact, but I don't wear it all the time because I have itchy eye, I've got dry eyes. So
Okay.
I wear it only for convenience,
Okay. Okay. Wow.
or when I want to change the color of my eyes.
Thank you, Dr. Chi.
And I
Um,
must add this: contact lenses, do not buy it online anyhow. go to a professional because you don't want to infect yourself, because you got higher risk of infection if you just pick up contact lenses without being properly prescribed.
Prescribed. Oh, yeah. I don't see any question here. Please, if you have any question, uh, go ahead and ask your question. And before I let Dr. Chi go, if you have any question as a parent concerning your child, please feel free to ask, and she would definitely answer the question. Um, Thank you, Fumi. Thank you, thank you, thank you, ladies, for being here. Today we've touched on a lot, and today's topic is visual impairment in children. As a mother, as a parent, as a father, we love our children. We want to see them thrive. We want to see them grow. We want to see them do amazing things. And because that's what we want, their vision, their eyes, their sight is very, very important. So, Dr.
Can
T.
I add something? I just something flashed in my head,
Okay.
because we've got a few people that have kids with sickle cell anemia.
Ooh,
It's a very sensitive area, and people don't take into cognizance that sickle cell can affect your eyes,
wow.
and lack of vitamin B can affect your eyes. So they could form some form of anemic problems that can lead to blindness. So if you have a child with sickle cell, or
Mm-hmm.
a baby born into sickle cell, I would say your eyes are as important, because the same thing that can cause anemia could also lead to blindness. And it's not about you saying, oh, let's give glasses. Everything isn't glasses. Sometimes we need to do more than glasses. And of course, the commonest one, diabetes, can also lead to visual impairment, because we have bleed at the back of the eyes.
Wow. Wow.
And then for babies, we have traumas, falling, cut deaths, kids falling, they bang their head, and they didn't think it was anything. And
Wow.
they rolled down the stairs, they didn't think that was anything. And then you end up having a child who now has lazy eye. You've heard of lazy eye. One eye working is open but not seeing. So this is a very broad. I'm sure maybe we shall meet again to have a chat. But there's a lot in visual impairment than just this short space of discussion. But mothers, fathers, you need to look at your kids. When they fall and bang their head on something, don't take it for granted. It could be more than just a bang. So that
Wow.
we can save a stitch in time saves nine, they say.
No. Yes. Yes.
Mm.
Whew. Thank you, Dr. Chibuzo Wadi. It's a pleasure having you here with me on Moments with Toying. Thank you for thank you for spending this Saturday with me, with
Thank
us.
you.
Thank you so much. I would go back and listen to this because I need to get every juice that you dropped here. I need to
Thank
get
you.
that so that I can also help my students and support my parents too. So thank you for the depth of knowledge. Thank you for sharing what you
Thank you.
have. Thank you for the impact you're also making in your
Thank
profession.
you.
So it's not just about improving sight, but also impacting lives. So thank you so much for
Thank
being here with
you.
me.
Thank you.
Thank you, people, my people, Dr. T's people, for those of us that joined in and stepped out. Thank you for being here. It's been an amazing week, and an amazing conversation. I hope you enjoy the rest of your weekend because I will. And
Me too.
yeah, yes. And so yes, so this is me wrapping today's moments with Tony up, and I'm saying thank you for everybody. Thank you to Dr. Chi for being here, and I guess I'll see you on the other side.
Thank
Okay then.
you.
Yeah, bye bye, and see you next weekend.
Bye. Thank you.
Okay, Dr. Chi. Um,
Should
yes.
I get out?
So
Okay.
let's end then broadcast.